everyone. I'm Cathy Haut. I'm the Director of Nursing Research at Nemours, and this is really exciting for us too. This is the largest grant that I've ever gotten. So we are very anxious to move forward, and we start our program as of November 1st. So this grant was through HRSA, and the purpose of the grant was to advance nursing education at a higher level, to increase the numbers of primary care providers in an area. So obviously in Delaware, we have about more than 2/3 of the state that's considered rural or underserved. So we looked at this opportunity as, in addition to the fact that Aaron Carpenter had already started a program similar to what they were asking for in 2017, and his program involved 2 nurse practitioner graduates who were trained over the course of a year through a fellowship program. So this is essentially the same, but we were awarded funding to support it. So our application requirements and objectives included to increase the number of primary care providers in rural and/or underserved areas, Delaware, and increase the diversity of providers to better match the population served, which we do have as an objective for our program, to increase access to mental and behavioral health care. And that was huge. And I'm going to explain how we did that with both our own psychology department as well as the University of Delaware. Create linkages with community organizations and/or educational facilities. Many of these grants went to federally qualified health centers, and their objective was to merge with a academic institution. So we're in this similar situation where we were charged with working with our educational partners, and I'll tell you about that. Incorporate telehealth training, and this was kind of interesting too, because we've been doing it for several years, but we may not be doing the best job with it. So there is more formal training that can be incorporated. And then to collaborate with other grantees to bring our data and share our outcomes together. And we are in the process of working with 3 other institutions: Arizona State University, Vanderbilt University, and a federally qualified health center in the state of Kentucky. And our grant collaboration, which was a required part of the grant, primarily was with Nemours primary care practices and the psychologists that work in those practices under the direction of Dr. Megan Lines. We are working with the University of Delaware Center for Training, Evaluation, and Community Collaboration with Ryan Beveridge. And what they are doing is hiring a postdoc psychologist to actually provide 8 hours a week of training for our nurse practitioner fellows. At the end of the program, they hopefully will be able to become credentialed as a psych mental health specialist. And then we're working with our friends at Thomas Jefferson under the direction of their dean of the nursing school for some preceptor support, research development, which is really important to us, and then support for some of the educational work that the fellows will get along the way. Our outcomes, data collection, and we're in the process of looking at lots of opportunities here. But from the grant perspective, we have to demonstrate a self-evaluation process for the fellows, for the graduates, and then to have the fellows evaluate our own program and their quote-unquote preceptors. In this situation, these are going to be fully licensed nurse practitioners who will be caring for patients, but they will have more of a mentor/preceptor in the practices. The preceptors will evaluate the fellows along the way. And, our goal obviously is to provide wonderful expert providers at the end of their 1 year of fellowship. And then the opportunity for the fellows to obtain credentials. And there is a national credential for a pediatric primary care mental health specialist, and they can add that to their nurse practitioner certification. Obviously, the goal is to increase the providers for rural areas. So we want to watch retention of the fellows in the state of Delaware. So we will be monitoring this is a 4-year grant, over the course of the grant, the number of those fellows when they're finished the program. we currently have quite a few that have ended up staying at Nemours, which we really would love to see. But whether or not they stay at Nemours or work in another area of Delaware will be something that we'll be following. And then the other thing that we thought was really exciting was the opportunity to work collaboratively with a different profession. So with psychology, we are really looking at opportunities that we can do some data collection and how well this interprofessional educational program works as we design, because we really are starting from scratch, designing the educational program along with some preceptorship from the psychologists who are working in the primary care practices. So we are really excited. Just a brief information about the previous program, which included 2 fellows per year. And the educational content was similar. The process was over a year. And like I said, some of those fellows still work with us here at Nemours. We were able to increase the fellows by 4, and that was the guidelines from the HRSA grant. And HRSA will be funding some of their salary. And we are, again, able to look at our educational program. We feel that we are the only pediatric institution that was awarded this grant this year, and we have been one of the few programs in the country that has had a pediatric fellowship for the last several years. So I'll stop